With us is Dr. Kinglsey Moghalu, an award-winning economist, author, academic, and diplomat who also served as Deputy Governor of Nigeria's Reserve Bank from 2009 through 2014, where he played a pivotal role in seeing the Nigerian economy through the 2008 financial crisis. He also helped raise billions of dollars to fight HIV/AIDS, TB, and malaria while serving as a senior executive at the Global Fund in Geneva in the 2000s. Thank you for joining us, Dr. Moghalu. Leaders across the region and beyond are now saying that Africa's response to the coronavirus, the lockdowns, the cessation of business activity, is actually risking more lives and deaths in Africa than the virus itself. Now, according to the International Growth Center, an additional 9.1% of sub-Saharan Africa's population has fallen into abject poverty as a result of COVID-19. 65% of this increase in poverty is attributed to the lockdowns alone. And then there's another estimated 8 million people in sub-Saharan Africa. That's 3.6% of the population, including nearly 4 million children under 5, are now severely deprived of food. And that was after 8 weeks of the lockdown. What do you have to say about this? I mean, Africa's debt burden alone makes it financially incapable of delivering direct financial support and social protections to people like we're doing in the West. I agree with my dear friends, Dr. Ngozi Okonjo-Iweala and Dr. Donald Kaberuka and others who are saying that the health crisis in Africa is now morphing into a full-blown economic, financial, and food crisis. Now, if I can get into what you're talking about, you have really been talking about the need for a vaccine in Africa, and you've called on the continent to tap into its own scientific capital, buried in the forests and ecosystems across Africa, as you state. And so what you're basically asking African countries to do is to totally debunk scientific imperialism of the West and focus on homegrown vaccinations. But whether COVID-19 vaccination comes from the West or comes from Africa or comes from China, what we know for sure is that a vaccination will not arrive on time. People are still dying in Africa and beyond, their lives and livelihoods still disrupted. Absent a vaccination, what is the economic prescription for Africa in navigating this pandemic?
Well, thank you, Rosa. There is no question that the COVID crisis has really hit Africa very hard, especially from an economic point of view. To some degree, you cannot blame the governments in the continent for responding instinctively with a lockdown for an initial period, because people just didn't understand the virus, except that it was terribly infectious. But now we've seen that, the lockdowns could be doing more harm than good if they continue. In the context of your question about what's the economic response, there are 3 responses. One is short-term, one is medium-term, and one is long-term. The short-term response from African governments that I've advocated is that they need to repurpose their annual budgets for 2020 to dealing with the implications and the impact of COVID-19. That means that any expenditure is not absolutely necessary right now. Anything that can wait should wait. And that money in the budget, at least 50% of national budgets, should be repurposed to providing social support and protection for citizens emergency improvements to healthcare and just, creating the possibility to be able to respond to the pandemic. So that's the first short-term response. Repurpose all budgets. This is the crisis now, and it's an existential crisis, both from a health standpoint, but even more from an economic standpoint, from what we've seen. The second response is a medium-term response. Many African countries are taking loans from the IMF, emergency financing, to respond to COVID. Ghana has taken $1 billion from what I know. Nigeria has taken about $3.4 billion. South Africa, and so several other countries. Now, the question is, how do African countries use? That's a very, very important question. They need to think very carefully. And I am saying that these loans that are being borrowed from the IMF should not just be used for balance of payments support, but they should be used to tackle the roots of the economic crisis. That is to say, begin to create jobs for the millions of Africans who are losing their livelihoods because of COVID. So in Nigeria, for example, I have recommended that out of the $3.4 billion, they should take up about $500 million minimum and set up a public-private partnership venture capital fund that will train unemployed Africans, whether people in the urban poor or the youth, or people in the rural places, give them the skills that they need to make a good life and a decent life for themselves, and then give them equity capital to start new businesses after that. So this is a strategic response. So you don't just blow the money right now, and the fundamental problems of the economy, which have been made worse by COVID, will remain after COVID. So this is why I advocate this type of response. And that's the medium-term response. Now, in the longer term, I think African countries need to think a lot more about their economic management based on the lessons that COVID has taught everyone. They need to build up savings funds, because you should always anticipate, some tail risks that can, appear anytime in the world. They need to build up savings funds. They need to reduce their dependency on, commodities and natural resources. And we've seen what happened with COVID, that countries that rely on those kinds of things for their income have been basically decimated. And third, they need to leverage technology a lot more. Africans have shown a strong affinity for technology. We are the most mobile phone penetrated continent in the world. So we need to be now strategic about this post-COVID. We need to invest in broadband infrastructure development in partnership with private sector companies that want to invest and make money, not the governments financing this, because they can't. But I know that people like Mark Zuckerberg of Facebook and several other investors are trying to build broadband pipelines across the continent. This needs to be accelerated so that the spin-offs from technology, the broadband that is available, can be used for various kinds of entrepreneurial ventures. So this is my approach in terms of how should Africa respond economically to COVID, the short term, medium term, the long term.
Well, that is some very wise counsel, Dr. Moghalu. I hope that African leaders are listening when you talked about the short term, the medium term, and I also like what you said about, in addition to looking at direct support, we need to look at how we can use the funds to catalyze job creation and infrastructure development. Thank you, Dr. Moghalu. In your advocacy for Africa, notably in your book, which I should say, I love this book. It's required reading for my entire team. Your book, Emerging Africa, How the Global Economy's Last Frontier Can Prosper and Matter. Now, in this book, and even in your advocacy, you identify the lack of a worldview as one of Africa's greatest challenges. Now, when I first heard you years ago speak about this lack of a worldview as being one of Africa's greatest challenges, I remember we were in Washington. And I was just surprised that you said that. I mean, I was taken aback because at that time, everybody was talking about HIV/AIDS, low level of agricultural productivity, the paucity of infrastructure, and human capital as being the greatest obstacles. And then you said, but no, the greatest of the obstacles is a lack of a worldview by Africa. And that without a worldview, it would be difficult for Africa to ever rise to global and economic prominence. But you literally really took the air out of the room with this. So I wanted to, can you explain more about what you mean about the adoption of a worldview for Africa? And can you tell us, should this be a one worldview for all of Africa, or should each African country have its own worldview? And right now, in the face of this pandemic, how would a worldview help Africa?
Well, when I talk about a worldview, I am talking about how we see the world and our place in the world. And even at an individual level, everybody has a philosophical perspective on life that serves as a roadmap for how you relate to people, how you relate to your aspirations, and how you pursue your aspirations. And so at the level of countries, this is also very fundamental. And in the book you refer to, and thank you for the kind words, I explore and make the proposal that the rise of the Western world, the rise of Asia, have all been based on worldviews, a philosophical perspective on life. And in the context of Africa, I mean by a worldview, who are we? Where are we coming from? Where are we going? How do we intend to get to where we're going? What is the ethical system that should guide our societies? What is the strategy for success? What is the system of knowledge? How do we learn? How do we perceive? How do we know? And what are the building blocks of our worldview? So this is what I mean. And I find that a lot of times in Africa, we get into activity for the sake of activity without thinking it through. But there is a saying that as a man thinketh, so is he. And same thing for a woman. So this is what I mean by a worldview. It is the absolute foundation that will get your trajectory right, because you know where you're coming from, you know where you're going, and you have a plan for how to get there. It is called, in other words, global strategic intent. So that's what I mean by a worldview, and I found that lacking in Africa. Now, the context of COVID now, first of all, you say, should it be continental or should it be national? I think that these kinds of things are very effective when they are done at the micro level. That is to say, every African country's leadership and citizenry should try to develop a worldview. And it is the job of the leaders to do so. It's very, ever rarely the job of the citizens. So when you look at America and you say manifest destiny, land of the free, home of the brave, the shining city on a hill, it wasn't the American citizens who came up with these kinds of views. It was their leaders, the founding fathers at independence, and that became part of the ethos of this. So this is now in Africa, of course, because we have a common experience, especially in sub-Saharan Africa, of colonialism. We have a common experience of poverty, and so we have common challenges. Now, it is possible to also have a continental worldview at a broad level. And this is also necessary because you find, for example, that our countries are engaging with China as a rising world power, but they're being played off against each other. If you had a continental application of this worldview, we would know that we have a common interest and we have common experiences. So how should we as individual countries, but part of a continent, face the world, especially, for example, rising China in today's world? Just as we had a worldview towards the West when we were colonized, all the African countries fought for freedom and got it, political freedom. But as the musician said, now that we've found love, what are we going to do? Now that we have freedom, what have we done with it? And that's where economic emancipation comes in. And you cannot achieve that without a very strong worldview. Now, bringing it down to COVID, what does it mean? It means that in the area of healthcare, we need to understand that health is wealth. That's the foundation of everything. And so we must reposition our priorities in African countries to invest a lot more in our healthcare, because that's your basic security, that's your ability to be productive. The next thing is education and skills. So basically, investments in human capital. You know, social infrastructure is foundational. You can build all the roads and all the bridges you like, and they are important. But if you don't have a healthy population, if you don't have a skilled, educated population, you're not going to be able to make the best use of these infrastructures. So this is what I mean by applying the worldview approach to governance and economic strategy in Africa. We need to focus a lot more on health. And the COVID crisis has shown us that African governments have lacked capacity, that many of our countries have very weak health systems. So that's it. And then when you apply it to the economic area, applying the worldview to our economic planning and our economic thinking means two things. Number one, it means that we have to understand globalization. Globalization is not random. It's not benign in its intent. It's not agnostic in its belief. It is a planned thing. There is an intention to dominate behind what we see as globalization. And globalization, takes place through mainly technology. So it's technology that shortens the distances around the world and make us feel as if we're just one big global village. But I'm just saying that if you have a worldview, you will understand that some people are driving that agenda and some people are profiting from it. And Africa has become far more of a market for the products of globalization. But we need to become part of the productive value chain of globalization. And that means we have to have a skilled work base, a skilled workforce. So we come back to investments in human capital and skills. Now, the second dimension of the worldview, economic thinking, is that we need to understand that depending on raw materials and oil and gold that is raw and raw agricultural commodities will never make Africa wealthy.
Hello, I'm Rosa Whitaker, President and Vice Chair of Dominion Television. Thank you so much for watching our YouTube channel. If you like this video and the content, please click the subscribe button below and join us on this journey. Our journey is to lead by our faith and reclaim the prevailing culture and the airways for Christ. Thank you so very much. May God richly bless you.